Outreach services can be a vital part of providing community-based, proactive supports for people with mental health and other social service needs. Outreach services are defined as any approach to delivering social and health services that is in an unconventional way. But more precisely, we might describe it as a service that meets the person where they are. And so that can mean meeting them in the physical location where they're most likely to be found. But more importantly, it means meeting the person sort of on the mental and emotional level where the person is most comfortable. For many of the people we'll support, being able to come in the front door of a service and speak to a staff person is a very intimidating thing. In many cases, they have never done it before, or even worse, in some cases, they've done it before and had negative experiences. So we want to make sure that we go out and find people. And as we've spoken of, many people actually don't know where to go and find help. So this is another reason why we want to do outreach. So it means working in the environment and at a pace that's suited to that individual. And in some cases, that pace can take quite a long time. The person can be in what we call the pre-contemplative stage, or the stage where they haven't yet decided they're going to receive help for quite some time. And it's all we can do to develop a relationship with the person at that time, be accepting and non-judgmental, and be available if and when they do decide they're prepared to move on to other levels of help. The idea behind outreach is that we build trust and relationship, as we've said, and we engage that pre-contemplative consumer. It can take great perseverance on the behalf of the professional or even the volunteer that decides to take this outreach approach, and it takes insight. One has to spend some time thinking about the approaches that are most likely to work and why, and really try to get behind the consumer's perspective, be empathic and understanding of why they're challenged to receive help. It's not just the work of designated professionals. There are examples of outreach in the volunteer world. There are examples of outreach, we could describe them as such, in family and friend circles. And there are examples of outreach that are not in the traditional psychosocial realm, but in the case of the people we're talking about in this course, may still be very therapeutic and helpful. So who provides outreach services locally? Well, in terms of the sort of outreach services that we generally mean when we're talking about people going out and connecting with consumers directly in the community, one of the groups is Impact Youth Substance Use Services, and Impact is located in Abbotsford but holds a contract for Fraser Health to work with youth in mission. So if you are concerned about somebody that's a regular in your restaurant or your arcade or your business, that's a young person under the age of 19, particularly because you think they might be involved with drugs or alcohol, and you've established a bit of a relationship with them, or you think that somebody needs to do that, then a phone call to Impact might actually get you on the road. For seniors, Mission Community Services offers both formal and informal outreach programs for seniors, including peer-to-peer programs where an individual can simply have what they call a friendly visitor. And this is a very vital part of helping people to remain psychologically well, because not only is that social connection mentally stimulating and physically stimulating, but it also allows for some monitoring to occur, and often that friendly visitor is somebody who can acquaint their host with services or with other people in a social circle, so that that initial visit becomes a conduit to something more impacting. Within the Mission Public School District, there is a hospital homebound teacher. If you're taking this course someplace other than Mission, you should inquire as to what's available in your district. Is there a teacher or set of teachers that go out and work with individuals who are homebound because they have an illness or because they have a behavioral challenge or developmental challenge, a mental health issue, or any combination of the above? And there are variations on this theme. So there are, in fact, in Mission, for example, there's Summit Learning Center, the very program through which you're taking this course, Riverside College, and these are approaches which allow us to provide kind of a tailored approach for students that may not be able to go into the mainstream at this point. So they may be able to do that part of the time. They may be able to work towards that. And the hospital homebound teacher is really a purely outreach approach, where that teacher genuinely goes out and works with people in the hospital, in their home, or a combination of both. There is a great deal of multicultural outreach in many of our communities. In this case, Fraser Health provides those services, and has individuals who go out, offer translation services, or go through community facilities that are culturally rooted, such as the local temple and so forth, to offer services in a setting that may be more comfortable for people. So, for example, you may see a flu clinic being set up through a Sikh temple as a way of making sure that people who do not speak English as a first language are going to feel comfortable coming in and knowing they're going to be able to speak to the medical personnel on site. There's absolutely no reason that the same kind of approaches can't be used to give people education or connection to services in the mental health realm through Fraser Health. The RCMP, many people may not understand, have a tradition of being more than just response to crime or response to complaint interveners. The history of the RCMP is such that without the help of the Northwest Mounted Police and the Royal Canadian Mounted Police, it's very likely that we would not have settled the western parts of Canada. They were not only the people who responded when there was disorder and crime, but they were also the people that welcomed individuals into the community, offered basically a welcoming. They were often a conduit to other services that existed, and they went around and checked on people who at that time lived very remotely. Well, I'm hoping that for many of the RCMP that may be taking this course, that's a part of your job that you still feel proud of. And in fact, if you're working in any type of first response capacity, whether it's for another police officer, another police department, whether it's first response to a fire department or BC ambulance, if you have the opportunity to get to know somebody and participate in a little bit of community outreach, I think that's a valuable, valuable thing. The faith community often has taken on this role. And again, historically, that's very significant. The very first social service workers in Canada really were actually faith-based people, and they were out there running the orphanages and the schools and the social services as part of what they did within a congregation, and that included the clergy as well as the congregation themselves. Here in Mission, we had the Union Gospel Mission. At one point, it did offer a meal to people on a daily basis. It did have a kitchen open. No longer is that done. However, Union Gospel Mission does still have a presence in Mission in terms of outreach and in terms of Lydia House. And many other churches do the same thing. And if you are watching this program as a member of an active congregation, then it might be something that you suggest to people within your own congregation. Is there a way for you to perform some form of outreach function? And I want to ask you to take some time now in your journal to think about or do a little bit of research in determining who are people or organizations in your community that provide outreach services. Does your employer provide that? If so, make sure that you put that into the journal and let the rest of us know, because sometimes the great irony of outreach services is that we don't know they exist. So take a moment and make a note of that, and we'll see you in the next video.